friends, Pradeep Pindyala, Professor of Anesthesiology. Today I am going to discuss something very interesting. Why? Because this question is being asked very frequently to all the MD postgraduate students of anesthesiology. And what is that question? Newer modes of ventilation. New modes, latest modes of ventilation. What are they? They always get confused. Please, for God's sake, do mention NAVA when this question is asked. What is NAVA? Neurally adjusted ventilatory assist. Okay, ventilation. NAVA, neurally adjusted ventilatory assist mode of ventilation. NAVA is actually a closed loop mode of ventilation that delivers breath proportional to patient's inspiratory effort. How is that happens? How does it deliver breath proportional to the patient's inspiratory effort? How does it come to usage? NAVA uses diaphragmatic electromyogram to detect inspiratory effort of the patient. An esophageal catheter with electrodes placed at the level of the diaphragm is used in NAVA to record time of initiation and strength of contraction. By that, you deliver exact amount of breath proportional to the patient's inspiratory effort by usage of his diaphragmatic effort, movements. Okay. Now, the other thing you must mention when being asked newer modes of ventilation, APRV. That is airway pressure release ventilation. What is it? APRV is a bi-level mode of ventilation, especially in the open lung ventilation strategy we use APRV. It provides two levels of CPAP. CPAP is continuous positive airway pressure. It provides two levels of CPAP with inverse IE ratio. Normal is 1:2. Here we use inverse IE ratio, that is 2:1. Okay. The rationale of APRV is to prevent alveolar collapse and maintain recruitment of alveoli. Okay. The other things you must mention is VAC. What is VAC? Volume limited assist control ventilation, and also PAC, pressure limited assist control ventilation. They are the newer modes of ventilation. And one more, SINV and PSV, both combined. You have heard about SINV, synchronized intermittent mandatory ventilation. This is also clubbed with PSV, that is pressure support ventilation. That is the beauty of the latest mode of ventilation. And I'm sure pressure support ventilation is usually rarely used normally unless it is during weaning of mechanical ventilation. We always use pressure support ventilation alone during weaning from the mechanical ventilation. Other types of modes of mechanical ventilation are, as you know, controlled mechanical ventilation, volume limited and pressure limited ventilation, and intermittent mandatory ventilation. You all know. And as I mentioned, APRV, airway pressure release ventilation, or bi-level mechanical ventilation, which are less commonly used as initial settings of the mechanical ventilation. Many people write high flow nasal oxygenation also when this question is being asked. I think it's not necessary to use it because it doesn't come under newer modes of ventilation. However, even if you mention, the marks may not be deducted. Coming when you don't have enough material to write, you can include high flow nasal cannula oxygen therapy, which is a recent technique delivering a high flow of heated and humidified oxygen. High flow nasal oxygenation is simpler to use and apply than non-invasive ventilation and appears to be good alternative treatment for hypoxemic acute respiratory failure, that is ARF. Okay, now high frequency nasal oxygenation is better tolerated incidentally than the non-invasive ventilation, and it delivers high fraction of inspired oxygenation which generates low level of positive pressure and provides washout of dead space of the upper airway, thereby improving mechanical pulmonary requirement. So, this is how acute renal failure is treated by high flow nasal oxygenation. I'm sure this small talk is very useful, and do mention what all things I have mentioned just now in this 5 minutes of talk in your answering to the latest questions of MD anesthesiology. Have a wonderful day. Take care. Bye bye.